The United Nations foresees that the economic fallout from the pandemic is likely to get much worse, fueling fears of a global recession. Many once reputable airlines are already grounded, leaving thousands of jobs in uncertainty all over the world. Back home in Nigeria, an economy driven by crude oil, the concerns are obvious. A steady dip in price of crude forced a review of the budget benchmark to $30 from an initial $57. And now the black gold sells for $20 per barrel. Government is spending on social intervention as capital projects are suspended. For how long can government sustain this in the face of current realities? Joining me on the news to help us better understand how global economy is reacting to the coronavirus pandemic is a political economist and former deputy governor of the Central Bank of Nigeria, Kingsley Moghalu. He joins us from Washington, District of Columbia in the United States. Thank you for joining us on TVC News at 10. You are in the U.S., which is now the global epicenter of COVID-19 with over 240,000 cases. When you think about your homeland, Nigeria, what is your assessment of government intervention to this pandemic?
Well, first of all, I can say it's a very difficult situation in which we find ourselves. And I would like to encourage the government, the federal government, the state governments, the private sector, and all individuals in Nigeria, citizens. It's a difficult time. We have very weak health systems, but despite that, I think we should commend the government for the efforts they've made progressively, even though we know that a lot more needs to be done. But we should learn important lessons from this whole crisis in terms of governance and the investments we should have made in healthcare, but didn't.
All right. In a tweet on February the 1st, you prayed that the price of oil would remain $20 per barrel for the next 5 years because you believe it would help government to wake up. How exactly do you see this happen?
Yes, because we've talked about economic diversification away from relying on oil for the past 40 years, and it has not happened. So what it shows very clearly is that there either isn't the political will to actually walk the talk, or it means that there isn't the economic management competence to achieve economic diversification. It doesn't matter what anybody tells you. What you have to look at is this: how much of Nigeria's foreign exchange revenues come from oil? It has remained over 90 to 95% for so many decades. So anybody can tell you stories about diversifying the economy, but the fact is it's not happening, it hasn't happened. So that's why I said perhaps the only thing that will make Nigeria diversify at this current trajectory is a massive crisis in the oil price, which will force our country to come to its senses, force our political class to begin to think straight, for them to think long term about the children of Nigeria.
All right, already there is an economic crisis because the recession is staring the world right in the face. But do you see Nigeria insulated against this global meltdown?
How can it be insulated when you are exposed so badly because of the country's total reliance on oil? So of course we're not insulated from it. We are one of the oil producers, and the price of oil has crashed to less than $30. So we're not insulated. Now, what Nigeria can do at this time, the best it can do at this time, is to spend a lot of money on the welfare of its poor citizens, especially in the context of a lockdown. You know, too many people are poor and can't survive without any economic activity. So if you tell them to stay at home, which is understandable because staying at home stops or breaks the cycle of community spread, but the government has to spend trillions of naira to put money into the pockets of Nigeria's poor. That is the only thing we can do now.
Powerful head of government disbursing some funds to the poorest of the poor in the country in a bid to cushion the impact of this pandemic. But then, in the past, we've seen leaders have to go on some form of medical tourism, one country after another. But this pandemic has really beamed the searchlight on our healthcare infrastructure and personnel. What do you think government can do to actually bring our health sector to standards such that we can tackle seen and unseen health challenges?
It's not rocket science. When healthcare is less than 5% of Nigeria's budget, when education is just about 5% of Nigeria's budget, then you know that the government is not prioritizing human capital. Human capital and social infrastructure like healthcare and education is the #1 infrastructure. So it's not to go and borrow money to build roads or to build bridges when you're not investing in the health and education of your citizens. So I would say that from the next budget cycle, Nigeria has to begin to get its priorities right and spend much more on healthcare. The basic health infrastructure fund needs to be activated. The Nigerian Health Act was passed in 2014, and it provides for a basic health infrastructure fund, with 1% every year contributed from the consolidated revenue fund before anything else. But this has not yet been activated. I think, this tells us, we can see now that health is wealth, and that our health and our lives are just the #1 priority. And we must shift our governance focus to such things.
But Prof, don't you think that these capital projects are also very essential, considering that now, for instance, when some parts of the country is on lockdown and people are home, they are crying for electricity and other basic needs?
Yes, of course. I mean, electricity is essential. But a lot of the money, the $22 billion that is about to be borrowed, is not being borrowed for electricity. That's the point. Some of it is being borrowed for $500 million to refurbish the Nigerian Television Authority. Excuse me? So when you're talking about even capital infrastructure, the priorities are not right. So if you're prioritizing electricity, that's fine. But that's not the basis of this borrowing spree that the government wants to go on. And you should never let healthcare and education fall behind. It must not be one at the expense of the other. But there are a lot of other things that are given priority, which in my view should be secondary.
In your estimation, what exactly does it take to put the Nigerian health sector back on track?
Develop a policy to implement universal health care. Now, I believe that every geopolitical zone should have a world-class hospital, at least one. And every state of the federation should have a very good facility. And then we invest in primary health care at the local government areas by making sure that we have the drugs, by making sure that we have the healthcare infrastructure, equipment, masks, ventilators, medicines, basic things. It can happen, but it needs investment.
Our political economist and former Deputy Governor of the Central Bank of Nigeria, Professor Kingsley Moghalu, thank you for talking to us on TVC News at 10.